Are you constantly battling with back pain, wondering if there's a way out without relying on endless painkillers? You may not realize it, but the solution could be as simple as a few changes to your lifestyle, diet, or daily routine. In this video, we're about to unravel the top 19 home remedies for back pain relief and a unique bonus tip that's going to change your perspective on managing back pain. So get comfortable, take a deep breath, and let's get started on your journey to a pain-free life. 1. Warm-up stretches. Ever noticed how a car runs smoother when it's warmed up? Your body works the same way. Incorporating simple stretches in your daily routine can help increase flexibility and reduce back pain. When you stretch, you're enhancing blood circulation, which facilitates healing by delivering oxygen and nutrients to the muscles and tissues. 2. Regular exercise. Contrary to popular belief, a sedentary lifestyle can actually worsen back pain. Regular exercise strengthens the muscles supporting your spine, enhancing stability and reducing the likelihood of pain. Try incorporating exercises like swimming or Pilates that are gentle on your back and help improve flexibility. 3. Balanced diet. Consuming a diet rich in calcium and vitamin D can help maintain strong, healthy bones and prevent back pain resulting from conditions like osteoporosis. Foods like leafy green vegetables, dairy, and fish are excellent sources of these essential nutrients. 4. Maintaining good posture. Remember when your teacher told you to sit up straight? It turns out good posture is crucial in preventing back pain. When you slouch, you strain your back muscles and spinal discs. Be mindful of your posture when standing, sitting, or lifting heavy objects to avoid unnecessary stress on your back. 5. Yoga and meditation. Yoga combines physical postures, breathing exercises, and meditation to enhance your physical and mental well-being. Regular yoga practice can improve flexibility, strengthen your back muscles, and teach you how to control your breath, which can help manage pain. 6. Heat therapy. Heat is a tried and true method for relieving back pain. Applying a hot compress or taking a warm bath can stimulate blood flow, relax muscle spasms, and soothe stiff joints. 7. Cold therapy. Just like heat, cold can also be beneficial for back pain. Ice packs can help reduce inflammation and numb the affected area, providing instant relief. 8. Over-the-counter pain relievers. Non-prescription medications such as ibuprofen or acetaminophen can provide temporary relief from minor back pain. Always follow the recommended dosage on the package and consult with a healthcare provider if your pain persists. 9. Mindfulness. Chronic pain isn't just a physical problem. It can also have psychological impacts. Studies have shown that mindfulness, or the practice of staying present and engaged, can help manage chronic pain and decrease reliance on pain medication. 10. Essential oils. Certain essential oils like lavender and rosemary have been found to possess pain-relieving properties. A gentle massage with these oils can provide relief from back pain. However, always dilute essential oils with a carrier oil before use to avoid skin irritation. 11. Massage therapy. A professional massage can be a wonderful way to alleviate back pain. Massage helps to relax tight muscles and increase blood flow to the area, promoting healing. 12. Adequate hydration. Water plays a crucial role in the health of your spinal discs. Staying well hydrated can help maintain the health of your spine and potentially reduce back pain. 13. Acupuncture. This ancient Chinese therapy can be effective in treating chronic back pain. Acupuncture involves the insertion of thin needles into specific points on your body, believed to stimulate the body's pain-relieving mechanisms. 14. Tai Chi. This ancient Chinese martial art is a form of mind-body exercise that can help reduce pain and improve function in people with chronic low back pain. It involves slow, gentle movements, deep breathing, and meditation. 15. Quit smoking. You might wonder how smoking relates to back pain. Well, smoking restricts blood flow to the discs and the spine, leading to degeneration and pain. Quitting smoking can therefore contribute significantly to back pain relief. 16. Weight management. Carrying excess weight puts additional stress on your back, leading to pain. Maintaining a healthy weight can prevent back pain and other health problems. 17. Regular sleep. Adequate sleep is essential for your body to heal and rejuvenate. If you're dealing with chronic back pain, make sure you're getting enough restorative sleep. 18. Adequate calcium and vitamin D intake. Both calcium and vitamin D are essential for bone strength. Deficiencies in these nutrients can lead to osteoporosis, a condition causing brittle bones, leading to fractures and consequently back pain. 19. Avoid high heels. High heels can throw your body out of alignment, putting pressure on your lower back. Opting for lower heels or flat shoes can help reduce the risk of back pain. 20. Embrace relaxation techniques. Techniques like deep breathing, visualization, or progressive muscle relaxation can help reduce the intensity of back pain. They work by making you more aware of your body, distracting you from your pain, and reducing anxiety. Potential drawbacks. While these remedies can be highly effective, they may not work for everyone. Chronic, severe back pain may require medical intervention, and some remedies may not be suitable for individuals with specific health conditions. It's always important to consult with a healthcare professional before beginning any new treatment regimen for back pain. So there you have it, 19 proven home remedies, plus a bonus tip for dealing with back pain. Remember, you don't have to live with pain. Simple changes to your lifestyle can make a significant difference. Please share your thoughts, experiences, or questions in the comments. And don't forget to like and subscribe for more practical health tips. Until next time, take care and stay healthy.